Hi, my name is Jackie Davis. I'm Executive Director of the Mental Health Association of the Eastern Shore. And part of a series of talks that we're doing, today we are going to talk about mental health and substance use. We have a couple guests with us today, which I'd like to welcome. We have Sheriff Joe Gamble from Talbot County and Trish Todd from Maryland Coalition of Families. Each will go talk briefly about the work that they're doing in the community, and actually have two different perspectives regarding this topic. So right now we're going to start with Sheriff Gamble. He'll do a little brief introduction about himself and the work that he's done in the community, especially in Talbot County with Talbot Goes Purple. Welcome, Sheriff.
Thanks, Jackie. Thanks for having me.
Well, we are delighted to have you here today. So tell us a little bit. We've had 1 year now of Talbot Goes Purple. Tell us a little bit about that program, what you feel that you've accomplished, and then now you're getting ready to start up with the second year of it.
Yeah, we're really excited about our second year. Our first year going into it, we really didn't know. We were kind of wading in unknown waters, I would say. We really needed to get an educational message out, and that's what Talbot Goes Purple is. It's an educational message, try to educate families, young people in our schools, our teachers, about substance abuse, what's going on in our community, specifically with opioids and the heroin epidemic. We talk a lot about the heroin epidemic, but what I refer to it's a pill epidemic. It's an opiate pain pill epidemic that leads to heroin abuse. So we wanted to get that message out to the community, and through a tremendous amount of supporters and a lot of hard work by a lot of good people in our community, we think we were fairly successful getting that message out. Our first year we really concentrated on the basic messages. How to dispose of your pills. What are prescription opioids? Excuse me. What are prescription opioids? What function do they have in our lives? We really challenge parents to question their doctors, whether for their children, whether they really need those things for maybe a tooth taken out or something like that, because all the studies show that our kids and what I'm seeing in Talbot County and across the mid-shores, our kids aren't experimenting with heroin. They're not going from marijuana to heroin. It's the pills in between. So we really want to get those messages out about safe disposal, talking to your doctor, what are the opioids about. This year we want to get deeper in our messaging. We want parents to start to be educated and start to understand what the underlying issues are in addiction. We know that there are kids in our community that just stumble into this addiction, and our numbers of addiction are so much higher than anything our country's ever seen before. We really want to get into those underlying issues and the mental health side of it, because we know, and I know, even though I'm not an expert in any of this, I know that mental health and addiction are just so commingled and intertwined.
Right.
So we really wanted to jump into that message this September, and that's why we want to partner with your organization and others to help get that message out to the community, help educate parents and grandparents of what to look for in our children, what to look for as our kids are being raised, and what we're seeing to get them the help prior to that early intervention that's so important. So we're really excited about Take 2 of Talbot Goes Purple in September. We'll be bringing a speaker in at the end of September, and we can have more details about that later or on our Facebook page and our website, but we're really excited about getting to that next level, if that makes sense.
Yeah, very much, and we're also very happy to be working with you.
Yeah, we're
we
really
do believe
excited.
It's a real tie-in between the two. And Trish, that's why we have you here today, so you can tell us first what I'd like you to do. I think more people need to understand and who or what Maryland Coalition of Families, who they are, what they do, and then specifically your role on the shore and what you were doing.
Okay. Maryland Coalition of Families is a family peer support organization. It's a nonprofit, and that's exactly what we do. Is we support families that have children that have mental health issues. We're supporting any loved one, so it could be a parent, or it could be a brother or for his sister. It could be an adult child for their mother or father in any substance use problem or problem gambling. So basically, we are a family peer support organization. We have 40 family peer support specialists all across the state, and they are each they're home based, so they work in their regions, and they have expertise in their own communities. Is what they do.
Do me a favor and briefly tell our audience, what is a peer support specialist? What does that mean?
Right. So a family peer support specialist is somebody who has that lived experience. You know, that's the #1 qualifier for coming to work for Maryland Coalition of Families. You have to have had some experience in one of those areas, those expertise. Unfortunately, mine is in both mental health and substance use. With my son, when he was very young, he was diagnosed with ADHD in school, and he struggled. He struggled through school, and I just didn't know where to go. I didn't have the supports. We chose the route to medicate him. For us personally, I'm not sure that was the right way to go at this juncture in my life. But I'm not saying it's wrong for anybody. I mean, you have to make those decisions yourself. But as a mom, that was what I saw at the time. That's what I was told, and that's what we did. I feel like as he maintained, but he never excelled in school. So when he got to high school, he really was struggling. He couldn't keep up with the work that needed to be done, and he started experimenting with pot and things like that. And then he got actually kicked off the soccer team because his grades were not good enough. And that's just sort of started the downhill spiral right there. I mean, he stopped hanging around with people that he knew. He started using pills, and that opioid addiction actually led to a heroin addiction for him that would span 8 years.
Wow. And so where is he today? And
So
what's
he's 7 months into recovery right now.
Yay.
So he's doing well. He's actually in Florida,
Okay.
but he's got a great job, and he's maintaining. So he's taking it a day at a time, and he's doing really well right now. So,
Now, you mentioned he's in Florida. A lot of people go to Florida when it
They
comes to
do.
trying to get into recovery. Are you aware of that?
No, I do know some people that have gone to Florida for recovery. I know that there are other options, more local for people, but I do know that there's a pretty substantial recovery community.
And why is that?
So I think the thing is that when you're in recovery, I mean, the treatment piece is just one part of it. And he has been to treatment in Maryland, he's been to treatment in Michigan, he's been to treatment in California. He just ended up in Florida. But no matter where you go, it's like you do that treatment. You do the detox, and then you do the that maybe a 30-day stay at a place. But it's got to be. There's got to be those community supports when you come out. There's got to be a purpose for you. There's got to be jobs. There's got to be meetings that you can go to. And what he found in Florida, and that's what he liked about it, was that there's meetings all day long, every day. We are starting to see more meetings here. I mean, because as they're needed. I mean, we have Celebrate Recovery meetings. We have there's a Smart Recovery meeting, I believe, in Queen Anne's County. There.
Now, in the one group that I was well aware of and worked with a little bit was Shore, Recovery for Shore. Is that also?
That is more an organization for awareness, and I'm sure they work pretty well with you all too.
Okay.
Just bringing awareness.
I thought they were for recovery.
They do more awareness events, and there are people in recovery there that are willing to spread the word.
And under the Recovery for Sure group, there are recovery pieces to that.
Okay.
So there are groups that also not answer to, but what's the word I'm looking for? There are groups under that Recovery for Sure umbrella that are like Celebrate Recovery. They also participate in Recovery for Sure, and there's
Right, they're members of that sort of organization, right?
So it's all kind of supports one another.
Okay.
But certainly there's we can go much farther in our recovery community here on the Midshore. I mean, when you look at some of these recovery communities outside of our area, I mean, they have hiking trips, and they do all kind of
That is exactly right. That's
If that
the main
makes
thing.
sense, yeah.
Yeah. You know, a lot of people, unfortunately, have, you know, legal issues. And so when they come out of treatment or you know, they might have had, be on probation, they might have, you know, convictions against them. So that makes it very hard to find a job, maybe even to get housing. So there's a lot of things that have to be community-based that are not, you know, that are not treatment.
What, have you heard other stories? I mean, we are trying to tie in a little bit more of the mental health piece this go around, especially with Talbot Partnership, or I'm sorry, Talbot Goes Purple. And what other can you share with us, other information as far as the mental health piece with, and then maybe that possibility of using drugs to maybe quiet the voices, or
Right.
maybe to settle our mind down? I mean, those are certainly areas that I hear and understand is right for drug use,
Right.
especially you know, with pot. You know, I think anymore when it comes to marijuana usage, it seems almost innocuous. You know, you have people, you know, there's I think there's a lot of confusion with medical marijuana and then pot you buy on the street, but that's why I say it's innocuous. It just doesn't seem to be that big of a deal anymore. And yet, you know, but kids are certainly, I'm sure, starting to, you know, that's maybe the first thing they start doing is using pot, maybe to quiet their minds down at night, maybe to
Right.
help them, because we know anxiety, excuse me, anxiety is a huge issue, not just with the adults in this world anymore, but with our kids. For a variety of reasons. So I'll let you speak if you can do a little bit of that.
Yeah, I mean, in my experience, people have either, you know, ended up with an opioid addiction through one of two ways, either because of mental health and trying to self-medicate, or, you know, as a result of an injury where they're, you know, they're taking prescribed drugs and they become addicted to it. But the mental health side that you asked about is, you know, it's just that everybody needs to belong. You know, and if you have extreme anxiety and, you know, you can't piece things together the right way, you know, it takes you longer. You know, we're in such a fast-paced society now, and things move, you know, I mean, there's no time to allow somebody to just kind of sit and think and come up with their answer and things like that. You have to, like, constantly be on the go, on the move. We never put down our cell phones anymore. So, you know, and I think that's a huge piece of it. You're on all the time. These kids, these young people are on. They don't stop, you know.
You know, I had a lady come into our office, and actually she was our bookkeeper, and she had at the time 2 kids, high school, and the one, her daughter was just getting ready to take her driver's ed test, the driving piece to it.
Right.
So they were going over to the DMV, and the whole way in, the daughter's texting to her friends, I'm getting ready to go in to get my license, and you know, that was all the daughter was really worried about. And the mother's trying to tell her, don't put that in there, don't do that, don't do that. And she, oh, Mom, it's fine, you know, and it just as confident as could be, and turned around and failed that test.
Oh, my.
It was worse when we were growing up. It was devastating enough if you failed that driver's test the first time around. And it was just, okay, you got to do
Right.
it better next time. That was
Right.
just it. She just told everybody in her sphere of friends. That was worse to her, that having to go and admit to them because she told everybody. That was more, you know, it was
Right.
anxiety producing
Right.
than the actual failing of the test.
Yeah.
I mean, it just, you know, that's where we are with the social media, just with all the electronics anymore, is that's what we have seen in our office is the anxiety that exists out there, and somewhat of the bullying issue. Now there's no escaping it. Where
No.
again, growing up, if were bullied in school or at the bus stop or whatever, we could come home. At least when you got home, it was your sanctuary, and you could get away from it for a while. Even if you had to go back that next day, you could decompress. You could maybe, you know, just get away from it. and self-protect. And now there is no getting away from it. It is with you 24/7. And again, I can, we've seen a lot of tragedy, suicides that are out there because that bullying and just never, and even to the point of being encouraged. There's that ugly, that kind of ugliness out there.
Yeah, we even have parents, like we get complaints all the time, and we even have parents that are bullying. They're bullying other students. I mean, it's, when you look at the social media thing, it's just an absolute mess. And, it comes down to the parents. Parents, we need as parents to address these things. We need to have time where we take this stuff away from our kids and be able to talk with our kids. And you don't see that. You see that with bullying in our schools, and, we want to blame it on our schools, but yet those things aren't being reinforced at home, and kids can't get away from it. And they're, at that high school age, and, what we're seeing at the sheriff's office is, kids starting to use alcohol or marijuana earlier. Marijuana is now almost socially accepted
Right.
in our society.
Exactly.
We have the medical marijuana stuff that's been legal for a few years, and full legalization's right around the corner.
Right.
And it really is scary, because I haven't met one child who is now addicted to hard substances, whether it's the pills or heroin, that didn't start with either alcohol or marijuana or both. And all the studies show the earlier they start, the more likely they are to become addicted at the end. So I think parents really, that's one of the great things about this conversation, is trying to educate families, educate parents about, hey, we need to look at this. We need to look at the mental health part of this for our kids, and we need to look at, when our kids are, what are we encouraging in the home? What are we encouraging with the text message, the Instagram, the Snapchats? It really is, it's just a mess out here.
And I think that's where our organization can help too, because we've lived through some of these things, and we've known we know what mistakes we actually made, or what we would have done a little differently. We're
Tell me about a mistake.
A mistake that I made. I probably was a little bit more lax with where my kid went. And I the first time he used marijuana, he told me, he said, "Mom, I tried it. It made me really, really sick. I'm not going to do it again." And I was really, proud of him for coming to me and talking to me about that and all. But I still let him go back to that friend's house. And if I had to do it all over today, that would not have happened. It just, no. You kind of, and what I did was I just gave him too much, I guess, independence or whatever in that to make that decision, because I thought he was making the right decision, not understanding that there's peer pressure with that too. Right. So I think I would have been a little more cautious on that.
Is there something that you can recommend or advise parents to be aware of as they're, I know one of the things that we are sort of at the Mental Health Association going to focus on in this next year with our mental health first aid program is to trying to reach out to parents in this transition years, that elementary to middle to high, and just helping them understand these are critical years, and there are some things that you need to be aware of. So we're really going to try to have a push in the next year to get parents to attend the mental health first aid youth course. But if you can now just maybe share with us a little bit about some things you think parents should be aware of or can look for with regard to the mental health.
The mental health side. I think, as I mentioned, my son had ADHD. So, in first grade, I can remember sitting there and them, telling me that the school was telling me, they thought maybe he had some focus issues and mental health. And so we took him to his pediatrician, and we did end up putting him on Adderall for that. But I remember sitting there at that meeting with the school just bawling, because I thought, oh my God, my kid's got a chemical imbalance in his brain, and now, looking back now, I think there are so many things at school, that to watch him struggle all those years and just lose all that self-esteem that he lost, I feel like, there's things that I just wished I had known. Nobody told me anything about a 504 or IEPs, which are individual education plans, or any support services until he was in high school. And and it was just too late then. We were already into the drug addiction, and he was self-medicating. And so I feel like there's supports out there. I felt like putting him in sports and having part of that team, and having him in really good activities and things like that was going to be the protection that he needed. And he's from a two-parent home, so we I don't think, I maybe a little easygoing on some things, but it wasn't just like free reign or anything like that. So I think knowing about those resources that are out there in the community, my son was also adopted. So, it seemed like he bonded pretty well with us. We never noticed any issues with that, but looking now and learning about, adoptive kids, sometimes they have, that's a trauma to them themselves. So I think just understanding all of that and being aware of it, we need to talk about it more. We just need to talk about it more. Kids, they shouldn't have to struggle, to find their way. We as parents need to educate ourselves so that we can find those things to help them.
Right, and we do have counselors in the school. Every school in the state of Maryland, they do provide counselors for children if they are struggling at all. And I believe, is it a free service, or does it go through the insurance?
Most of them are through their or through medical assistance, I think.
Okay.
I don't think there's very many private insurance.
Okay.
There might be a few, but none that I'm aware of. Most of them are medical assistants.
Okay. Were you aware of counselors in all the school systems?
Yes, I know that some of the school systems contract that out,
Right.
that they don't necessarily have a physical person in each school, but I know that there is help and mental health help through the schools. A lot of them now contract them out versus having somebody on site, every day,
Right.
if that makes sense.
Well, yeah, it does. I guess, but I don't think the schools have the room. They just physically don't have the space in their buildings to have somebody there every day.
Right.
So I think it's actually a logistics problem. Trish, in your work, have you seen more of one particular, do you work more with families with ADHD? Is it anxiety? Is it depression? Depression's another huge thing.
Right. I think, if they're young, that seems to be sort of the starting point, in my experience, is that a lot of them are diagnosed with ADHD or anxiety. And I always question, even with my own son, I said, well, somebody, because I sort of thought he had anxiety, but he was diagnosed with ADHD, and I thought, what happens if you put a kid on a stimulant and has anxiety? What does that do?
Right.
But nobody ever, and I didn't know to ask that question then. That's
Right.
the sad part. I trusted my doctors, and I trusted the school system, and I trusted other people that I had heard, and instead of just digging a little deeper. And I think that's what you really need to do. But I would say anxiety, is pretty big, as you mentioned. In that report that was done by Salisbury University a few years ago, certainly supports that.
Right.
And you probably see more depression with teenagers, I guess.
Okay.
So,
All right.
that's what I'm not a therapist, and I'm not a doctor, so I really couldn't say. I'm just saying this is what when I was working one-to-one with families, that's what I probably saw more of.
All right, Joe, now I know we talked briefly about, you were telling us about some clubs that exist in the school
All right.
system. So tell us a little bit about those clubs.
So in last year, we started Purple Clubs, Talbot Ghost Purple Clubs at the high schools. And we had a group from St. Michael's group from Easton High. Kind of launched those groups with some guidance from some teachers there. And then this year and those clubs basically are clubs that talk about substance abuse, talk about being substance free, and talk about helped us with our promotion of Talbot Goes Purple in September. And they meet regularly. We have speakers come in. We've actually trained them in Narcan, trained our high school clubs in Narcan, which is like a first, like that we're actually training high school kids with Narcan. So what we're doing this year is we knew that we wanted to get into middle schools, but we felt the first year we couldn't accomplish all that. So this year we're going into the middle schools with our Talbot Goes Purple clubs. We want kids to have a place and have a voice if they want to remain substance-free, if they want to remain sober, if they don't want to use drugs, use alcohol. And hopefully we can make that group, it can be a group that becomes the norm in our school. So we wanted to get it going in our middle school. We had some great volunteers step up this year who are launching that in our middle schools. So we're really excited about it. We're really excited because they do projects, like they had a door decorating contest. And then the winner, we gave them a prize in the school who had the coolest educational message on the door. And we want kids to head those things up. And, you know, if you walk into Easton High School, the first thing that you see in the main entrance there is one of their art projects they did with art of Talbot Goes Purple and some educational messages, some purple hands. It was their hands that they, you know, put on there to give them some buy-in so that kids can say, hey, I can remain substance-free, and help to educate other kids. We really need to change how our parents think, how we view underage drinking and marijuana, and change kids. You know, it was a rite of passage, and we need to change that, because what parents don't realize is 10% of kids are predisposed, and what we're talking about is predispositions today to addiction. Kids that might have imbalances, chemical imbalances, might be depressed, might, for whatever reason, they're predisposed to addiction. And that 10% of society, the studies show 10% of us are predisposed to addiction. Well, when you have a group of parents, or a parent that allows 15 high school kids or 20 high school kids to have an underage party at their house, think about that, 20 kids, so there's 2 kids that are already predisposed. And we know that the studies show the earlier they start with substances, the more likely they are to become addicted to harder substances later in life. So in essence, we've just started 2 kids on the path to addiction. You know, Chris Herron, who we brought here last year in the Talbot Goes Purple stuff, he really talked about that path to addiction. He really talked about, it really struck me as a parent, and you know, what we allow. I have 4 children. None of my kids are perfect, and I was not the perfect parent. And there are definitely things I would do differently, you know, as a parent. And I think that we just need to have that conversation. You know, what would we do differently? Well, there were things I would do. I would say, yeah, maybe my son doesn't go to this kid's house. Maybe those kids can come to my house because I know what's going on at my house. No, I didn't follow all these rules,
Right.
But you know, retrospect is 20/20 after you've raised your children. But I think that it warrants that conversation, you know, getting in front of the parents to help educate them about the predispositions, you know, that I had no idea that ADH kids that are diagnosed with that had a higher chance of addiction until recently, until just in the past few years. And I know that 90% of parents don't know that information, because we don't do a good job as parents of seeking that information.
Until you need
Does
it.
that make sense?
Right.
Until you need it. Right.
You know, I did this talk that I gave a lot in September, and I would say, okay, raise your hand if you talk to your kids about seat belts, and every hand in the room would go up. And I'd say, raise your hand if you talk to your kids about prescription opiates. And the first time I gave that talk was in front of about 400 people, and 11 people raised their hands.
Wow.
Which shocked me, and that's what motivated motivated us to start Talbot Goes Purple, to educating people. And I think if we had a group of people in here, and we said, all right, how many kids have been diagnosed with attention deficit issues? You know, and maybe 20% of the room's hands would go up, I'm guessing, you know, and then ask them, how many of you know that could be one of the predispositions to addiction later in life, or one of those risk factors, or whatever we want to call them.
Right.
I would venture a guess that most parents don't know that. You know what I mean? So we really need to get that message out, and the other underlying, you know, bullying and depression and some of the other things that we've talked about today.
Well, I was thinking as we were talking about the clubs, another piece, and I'm by no means an expert on this, but I think we in our education system and then just in general too, we don't understand that what's going on in the brain itself, the physical changes that are taking place. I mean, I know I just recently, in the last couple of years, learned about how the brain doesn't completely, form or, have it all together until about age 25.
And men's
then-
brains are
and men's
later
a little
than,
bit longer.
just-
and that's
now,
why
I
women
know.
are smarter than men, because our brains are still not developed.
And I think they
But
just
it's-
raised the men's age up a little bit higher than
And
that.
it's also, yes, but then there are things that like neuroplasticity that talks, but you can still change the brain. It doesn't mean everything
Right.
stops at that age, but it's going through so many changes in middle school and in high school, and different things are there or just getting started, and we don't talk about that. I mean, we don't know it, we don't talk about it, and I think that is key. I mean, even in the clubs, I was just thinking about the clubs, maybe one small part, because you want to keep them fun. Because you
Right,
want to keep
right.
the kids engaged.
Right.
But I think too, if you could do something that they could learn about their own brains and what's going on at that age that they are particularly at, and then that's something that I probably be a little cool to them, hopefully, if you do it the
Right.
right way, that they can then share
Right.
with their friends, and then they know what's going on and why it's so critical to stay away from these things while their brain is undergoing all that development.
And I think that's key, because I think that, we've been through this whole, when we were all young, we saw programs like Scared Straight and
Right.
all these programs that scare kids, and if you do this, this is going to happen to you. And I think that we've learned in prevention anyway, is that education is the key, and we need to educate young people because they're smart. These kids are
Exactly.
smart.
They
They're
are.
they're
Yes.
intelligent, and when you educate them about the frontal cortex not developing until this age, and the earlier you use substances, the more you're damaging that. I mean, kids will make choices. Kids can make choices, and I think they're going to make choices based on what we've presented them and what's true. I mean, you can't con kids. You
Right.
can't lie to them. You can't say, oh, marijuana's going to make your fingers fall off, or something like. You know what I mean? I'm exaggerating, but you need to present them with the facts, and you need to present parents with the facts, and then hopefully they digest that and make those good decisions. And our addiction rates are so far right now. They're so far out of any normal realm. And I hate to say that there's a norm for this, but it's just, I've never seen anything like it in 30 years of law enforcement. I've never seen the death and devastation that I'm seeing right now. And parents need to wake up, and they need to watch this program, and they need to do some self-study, and they need to go to things to learn more. And
Have you seen where parents this last year are either more interested, more involved, came out to talks, or?
Oh,
or do you
absolutely.
think- Okay, so you
And I
are-
think, I think sadly, the color purple isn't magic, right?
Right.
And we've been criticized by some people about, what's the color purple can do. In fact, some young man told his dad came up to me at a high school football game, and we were there handing out some purple stuff. And he says, hey, I just want to let you know what my son told me. He says, Dad, this purple stuff, these purple lights, what's that going to do? And he said an hour and a half later, after they bought dinner, they sat down, they talked for an hour and a half about the purple lights and what the message was.
That's what it does.
And the father says,
That's
well,
exactly
you know
what
what,
it
it
does."
worked, because we just spent an hour and a half talking about substance
Exactly.
abuse and addiction and all those things. So our community and across the shore, they're grabbing this. We've met with counties across the state: Washington County, Caroline County, Queen Anne's County, Somerset County just had their first purple event down there.
Cool.
The other day. So they've come to us, and we're just kind of saying, here's how we did it. And it wasn't us, it was the community that responded. When we presented facts to our business leaders, when we presented facts to our churches, when we presented these facts to different community groups to let them know exactly what was going on, they were all in. And our schedule was overrun with talks in September. I mean, I was out over 100 different events in September giving talks. I can't imagine how many people we talked to between late August and even, I was doing churches through November because there weren't enough Sundays in October. So people are hearing, I think people are hearing the message. I think they're hungry for it because everybody has somebody
Right.
that's addicted or that's struggling.
Right.
And I think that we, in our disciplines, need to do a better job getting our message out, because I think people are hungry for it. Parents aren't going to come to an event. They're too busy, right? You can't expect parents, between the 3 kids and taking them to soccer and this and that and PTA and all the other things, to show up at an event. We need to go to them and present our messages. And that's why Purple was
I was
successful.
gonna say, that's what.
We
that
went
is
to the
what-
practices.
That's what you did.
Moms and dads stand there and watch their kids practice when the kids are 8 years old. And we went to the practices and we went to the ball games. And, we said, hey, can we have you at a practice? And we would have parents come over at a practice while we're talking to the kids and educate parents, because we've got to go where they are. And that's why that was one of the main reasons we were successful. And we've got to turn this thing around. I mean, it's devastating. Maryland Coalition of Families they do a great job. I work with one of their peer support,
Family peer support
family
specialist.
peer support specialists, Val
Long
Albee.
title.
And we're on the phone just about every week together talking about some struggles that some families are going through. And she's asking me law enforcement questions. I'm asking her peer support questions.
Right.
And there is help. People are saying there's no help out there. There is help. I'm not saying there's enough help,
Right.
because there's
Right.
not. There's not enough help. But there is help for folks out there if we can just get them plugged in.
Yeah, does Talbot Goes Purple have a website?
Yeah, so it's talbotgoespurple.org.
Okay. And what all?
And then
what else
our
is there?
Facebook page. So there's resources there. We have a list of there's recovery stuff there. There's treatment. There's prevention. So we started prevention, early intervention, and go all the way through treatment. Not Talbot Goes Purple, but we have resources listed on there.
Right.
And if it's not there, then shoot us an email and we'll reach out. We'll find somebody that has an answer for you and try to get you some help. I'm not saying we have anything. I don't have any expertise in treatment, but we have resources on there of people like Maryland Coalition of Families and other groups that are there to help you and help you guide your family through this or guide your son or daughter through this. That's the most confusing thing. We were talking before the show about parents calling and loved ones calling and say, oh my God, I just found out that my son or my daughter, what do I do? And you've been through this,
Right.
so
Right.
that's
And that's the same thing at Mental Health Association of the Eastern Shore. We do on our website, we try to have resources and keep that up to date and fresh, but we get phone calls quite often where people, remember I just a week or so ago referred someone to you where, it's a husband and wife thing. So it wasn't a child, but still, I mean, he was just at his wit's end. The wife is in the throes of a drug addiction and half throws him out, then he comes back, and he's just he doesn't know what to do. So, that's one of our priorities where in the Mental Health Association is knowing those resources, knowing where to send people, because we don't provide that directly, but we feel that it's our priority is to know the resources and know where to send people and do it, and act right on it when someone calls. So there is no delay.
yeah, it's really important. I mean, you know that.
Yeah, I mean, I think, that there's this whole advocacy piece about, being vocal about what's going on in the community, and that's definitely important. But there's also, privacy too. I mean, if you're not ready to be one of those people that speak up, but you're still scared for your son, your daughter, your mom, your dad, whoever, you need to reach out and call. I mean, that's how we work with people. It's one-on-one. And we might be doing some prevention work. We may have moms call us that just found something that they're not quite sure, or they want to know some prevention tips or something. We might have people call us and they need treatment and they need to know how does their insurance work, and that is a whole daunting piece of the puzzle is figuring out what your insurance covers, how you can get somebody into treatment, and especially if you have an adult child. How do you get that adult person who has their own rights and can make their own decisions into into recovery. How do you facilitate that, from your within your family? So a lot of challenges, and that's what we like to work with people one-on-one to help them through that. And a lot of times it might just be communication. We're teaching people how to communicate with their loved one, because if, you mentioned before that we have to educate these kids, they're so smart. Just saying, I told you so, and do it because, it doesn't work anymore. It doesn't, nobody works that way anymore. They got to have the why. They got to understand the reason and what's available to them. So that's what we try to do.
Okay, very good.
And Jackie, they do a great job. I mean, their
Thank you.
organization,
Oh,
they
Thank
do
you.
a great job with families.
I've enjoyed the last many years, and
thank
so
you.
glad that I discovered them. I don't know how, but I'm so glad I discovered
Right.
you guys. You're
And,
great.
I mean, we hope that people, especially the people that have children that have mental health issues, will reach out to us before it ever gets to this level.
Right.
That's where we can really do some good work with kids and families and talking. I mean, you mentioned the brain, understanding that is huge. We actually have an active parenting program that we run.
Right.
And that is one of the things that you learn in that is, how does the brain develop, and what does discipline look like for kids, and and what are those levels, and how do you empower your kids to make those decisions when they're faced with them. So it's a great program.
Very good. Very good. Let's talk a few minutes that we have remaining here about maybe types of recovery that exists. I know NA, or Narcotics Anonymous, doesn't work for everybody. Maybe a support group doesn't work for everybody. Maybe a treatment. So if you can, Trish, a little bit, and Joe, certainly chime in if you about some of the maybe first variety of recovery, and then we can go into some resource that's available in the Midshore area.
Right. I think the most important thing to remember is that there's all different kinds of recovery paths, and then people can choose different ways. Some people choose to go to treatment. Some people can stop cold turkey. Some people might do it through medication. There's all different ways, and none of those are wrong. I mean, everybody should have the right to do a path, and maybe they have to try a couple of them to see what's right for them. As I said earlier, I think having something in your community is really important. Being able to find your purpose in life is a big piece of people that are in recovery. You got to think these people have been, just using drugs, and it just changes their brain. It changes the way they think. So they have to allow that to heal. They have to, and in doing that, they've got to have the place and the space to do that, I think, is a really important piece. They need to be able to find a job, but and sometimes, like, we might actually say to someone who is coming out of maybe even a jail or drug court or something, they've got drug court, they've got treatment that they have to go to, they have to find a job, they're living in a halfway house. So all those things are stressors on people that probably already have anxiety about, so we have to be really careful about we want to keep people busy, and we want to give them options and things like that, and that's where the community can really come in.
And I don't mean to cut you off there, but I think too, a key ingredient is hope.
Absolutely.
They've got to have purpose in life. But
Absolutely.
That's been
The
my mantra:
biggest.
is everybody has to have hope in their life.
Yeah, I'm glad you said that's the biggest. That is the biggest, hope and education. Families have got, they actually go through their own recovery when they're working, when they're dealing with someone.
Very
So
interesting.
you have to take care of yourself. I mean, a lot of times you put that addiction becomes like your life. You're living it just the same as they are. Maybe not taking the drugs, but you're still, everything you do is affected by that. So you have to deal with your own recovery. You have to be able to, set those healthy boundaries, and
I'm sure you had to build up trust again.
You
because
do.
If
It takes
if
time.
it's been that family member, then maybe there was a real likelihood there that they were stealing from you.
Absolutely.
They were,
Absolutely.
And so
I've-
you have to.
I
have
have
to
slept
work
with
on
my
that.
wallet under my pillow many
Oh, Lord.
nights,
Okay.
many nights, and you do have to build that trust back up, and it's that fear is there too, of how long does this go on? Am I gonna end up, losing him before I can, he can get help or whatever. So, and that's very traumatizing to families as well. So there's two recoveries that kind of have to happen simultaneously.
That's
So-
the person who is actively addicted as well as their family,
The
and I'm sure the support around them, their
Right.
natural supports that are
Natural
around them.
supports, Al-Anon, Nar-Anon, so all those organizations, as well. Celebrate Recovery also has a piece. So I think we need, I would love to see more meetings, and I think we are doing better with those.
Are you aware, can we confidently say that there are some type of meeting or support group in every county on the Midshore, or can we not confidently say that?
I believe they are, but they're not every night.
Okay.
They're not every night. So that's the other piece too, is that somebody may not have transportation. We know transportation is a huge problem here on the
Right.
shore.
Yes.
How do you get to those meetings, and that's where your recovery, people that are in recovery are supposed to help those that are seeking to go to meetings and things like that. But that's a problem. So, I would love to see our bus system kind of grow a little bit so that people could get to meetings, get to treatment, get to where they need to go. That would be really helpful.
Now, you had mentioned earlier, is it the Whitsitt Center, is that up in Kent County?
That's in Kent County.
So
right.
tell us a little bit about the Whitsitt Center.
Whitsitt has, and then they just actually put in some crisis beds. So, and that's part of our I think you could probably talk more about our safe stations here
Right.
in Talbot County that we've just started too, which actually would be a really good
Yeah.
good thing to tell people about. That you can get in there. I mean, you might have to go certain different ways, and that's where kind of knowing the system sometimes helps. You probably, unfortunately, might not be able just to call Whitsitt and say, I want to come in, I need a bed or whatever. It might be that you go to a crisis center or you deal with
So
it.
tell us,
So what we did, the Whitsitt Center has a certain number of beds. They're committed to, we call them crisis beds. And if someone responds to the 911 center in Talbot County, but Anne Arundel County started this project called Safe Stations. And people were going to firehouses, and they would basically, I need help, I want to get into recovery. How do I do that? They could do that at a firehouse. They could start the process there. We don't have paid firemen in Talbot County, so in rethinking that model, which was being somewhat successful in Anne Arundel County, we thought, okay, what's open 24 hours a day? Our 911 center is right there on Port Street Extended. So if you walked into the 911 center and say, hey, I'm here on Safe Stations, call, I need help. The dispatchers who are in there 24/7, they will notify EMS. EMS will come out, kind of evaluate them for health, make sure they're not going to overdose or have an issue right there. And then starts a chain of events to contact help, to come out with our CIT. I'm struggling here. Help me with CIT. Crisis intervention teams.
Yes.
So that triggers our crisis intervention teams to come out to meet with the individual and start them on their path to recovery, get them into treatment. So those beds are available for that. The other place they can go is to St. Michael's Police Department. And all they have to do is go there and say that they want help, they need help, and that will trigger those same calls. So those beds, there are some beds attached right to that will allow those crisis beds to get them into those beds very quickly. The shore struggles with mental health providers, with it all right now. Peer support, Maryland Coalition of Families does a great job, but they're way understaffed, as far as peer support. Health department has peer support people, but they're way understaffed. For the police, on the police law enforcement side of us, our link is peer support for us, is to get our arrestees or our overdose victims connected with peer support folks, whether it's Maryland Coalition of Families or the health department peer support folks, to get them to have into treatment, so they can start helping those people get to a meeting or navigate the system. And they're the navigators. The peer support people really are the navigators.
Right.
all right, we need to get this person to a bed. Sheriff Gamble can't do it,
Right.
but Maryland Coalition of Families can say, okay, here's where we think you can go. We can steer you in those directions. So I need all of the above. We need recovery housing. You know, we have had some more recovery.
We have had a couple nice recovery houses open, but you're right, we do need more.
Need more of
Definitely.
everything of the above.
I've heard of stories with the people getting in the hospital emergency room, and they want to do an emergency petition, or they want, they just need to go somewhere and be evaluated, and the wait, the hours of wait, not in the hospital, I mean, but like the hospital's made that determination, it's ready to move them, and they can't release them. There has to be a bed somewhere, and there are no beds, so they have to hold them. And it just creates, its own little crisis right there in the hospital.
Yeah.
That person needs help, be it a mental health issue or a drug abuse issue, and but they cannot discharge them because they have to safely discharge them, and they cannot because there are no beds, there are no placement for them that's currently available.
Right, and that could happen. I mean, suppose those crisis beds were booked, or were filled, then what's going to happen is the crisis team is going to help you figure out a safety plan, until they can get you into one of those, into a bed. Eastern Shore Mobile Crisis or affiliates on today, they're going to actually be there and have somebody that's going to follow up with you and make sure. So I think the Safe Stations is a great program. It's a great program. If you
Talbot
need
County
help.
the only county right now on the shore that has safe stations?
Yeah,
or
so
have
we
the
just
other
recently
counties?
kicked off the Safe Stations in Talbot, but yes, it's the only one on the shore right now with the Safe Stations program.
Okay,
Ideally, it should be at a firehouse. Firemen,
right.
there's that issue with law enforcement and people that are addicted, the trust barrier that we struggle with. But firehouses, but it's difficult to figure out. Okay, if we don't have people at our firehouses 24/7. They hear the fire whistle,
Okay.
and then they come,
Right.
jump in the trucks and head out. So that's what prompted the county to say, okay, let's do the 911 center. And then for the Bay 100, that's St. Michael's police station, just because it's the only thing that's open 24/7 in the Bay 100 area. So.
And then, like I say, just to reach out to your peer support, because we do sort of have some connections across the state and a network that we look at. So, maybe there isn't a bed here on the Eastern Shore, but maybe there is something on the Western Shore that we can, help. And mainly what we're trying to do is give, we're not referring people because we're not therapists and we're not counselors, so we can't do that. But we're helping people understand their options. That this is what there's a lady in Carroll County that actually will detox, she's a nurse practitioner. She'll actually detox people with medications and then start the Vivitrol shot for them, all on an outpatient basis. So there are options, you just have to ask. You just have to ask for them.
Well, that's a good way probably to end our talk today, is we can all just sort of give a quick update or a quick of where to find more information, Facebook, website. And so, Joe, we'll start with you. If you want
Sure,
to
if you want to find
out
out more about the Talbot Goes Purple, we have Facebook and website. It's talbotgoespurple.org or our Facebook, Talbot Goes Purple, and you can check it out. We're going to be updating stuff there on activities and stuff we're doing in the community, so you can visit us there. There's also resources on there as well.
Very good. Trish?
And our address is mdcoalition.org, and we also have a Facebook page, MCF Families. I believe there's actually an Eastern Shore, MCF Eastern Shore Facebook page too. We do the same thing. We're posting positions. We're actually currently hiring, if I can put that little plug in there, for the Mid-Shore area and the Lower Shore. You can find out all kinds of activities we do. We have family fun days, so it's not always just problems that we're dealing with.
Right.
There's family fun days, there's activities, awareness events, and then obviously you can connect with a family peer support specialist in your area.
Very good. And with the Mental Health Association, our website is mhmdes.org. We also, of course, have a Facebook page, Mental Health Association of the Eastern Shore, and always supporting each other. We're constantly posting not just in educational information, but just events that are taking place around mainly the midshore, but we also try to post things that are shore-wide that may have an impact. So I want to thank you all today. This was very
Yeah.
informative, and hopefully we've helped a few folks out there learn a little bit more about some of the issues that are facing our communities and our families. And we appreciate you taking your time, especially Trish. I know it's your day off, and you're a trooper here and a true peer-to-peer person by just coming in
thank you.
and spending some time with us. Sheriff, thank you very
Thank
much.
you,
This was
Jackie.
really good, and we appreciate it. Thank you.
Thanks.